My name is Arnold-Peter Weiss. I'm a hand surgeon at the Lifespan Orthopedics Institute. When I was a kid, I used to like to fix stuff and a lot of woodworking. So I was a very hands-on type person. And orthopedics, the old adage is it's kind of carpentry for the body. And it's a little bit like that. We use saws, we use screws, we use also finer instrumentation too. But I think that kind of physical nature of it, I really enjoyed that idea. The hand is a small area, but there are a lot of little parts in it. A lot of bones, a lot of nerves, a lot of tendons, a lot of blood vessels. And so you can have a whole host of conditions, from things as simple as carpal tunnel syndrome to things as complicated as wrist replacements or replantation if somebody injures or cuts off their finger, let's say in a snowblower. I think impacting patients' lives is really the end game for being a physician. I'm an academic physician, so I lecture a lot and I write a lot. I've written a textbook on hand surgery. I've got about 14 patents now. For instance, knuckle replacements, my patent has been the #1 selling patent for 20 years. But in the end, it's that personal interaction with a patient and wanting them to do well. And there's nothing better than when they come back and they say, I am so happy with Dr. Weiss with how this went. I really appreciate all your help. To me, that's the end game. Team approach to medicine is actually very important regardless of how specific your subspecialty is. So you can be a generalist like an internal medicine doctor or a pediatrician, or you can be highly specialized like myself as a hand surgeon or a neurosurgeon. But there are always conditions that have influence or are influenced by other people's expertise. And that's really, frankly, the great thing about Lifespan. There are really good people in a lot of different places in this institution.